Please, sir, please.
Shiva, Dr. Shiva.
Yes, sir. I am here, sir. Yes, sir. Yes, sir. I am here, sir.
Yeah.
Shall we start? Shall we start it, sir?
Sure, sir. Sure.
Yes, yes.
So, on behalf of Arundhati Kalasalingam College of Pharmacy, Krishnan Koyil, I welcome you all for the 11th virtual learning series for medical coding, global practice, and scope. And now I invite our beloved principal, Dr. N. Venkadeshan, sir, to deliver the welcome address. Please, sir.
Welcome. Since to manage of for access whole this 11th learning series on
So Dr.
navigation.
Your voice is popping out. It's distant.
So your voice is somewhat distorted, sir. கொஞ்சம் உடைஞ்சு வருது சார். Yes, sir.
அப்படியா?
இப்போ கேக்குது சார்.
ஓகேங்களா? உடைஞ்சு வருது.
இத வச்சு வாய் கிட்ட இருக்கோம்ல.
அருண் கேக்குதா? அருண் நல்லா கேக்குதா?
Yes, now I am.
கேக்குதா?
Now okay, இப்ப கேக்குது.
Okay, thank you. Okay. அனைவருக்கும் வணக்கம். I put forth my sincere thanks to our management for accepting wholeheartedly to conduct this 11th virtual learning series on the behalf of the management of Kalasalingam group of institution. Can you hear audible?
Yes, sir. Yes, sir.
Yes.
Okay. With the blessing of Almighty, our founder Kalvi Vallal Devathir T. Kalasalingam Ayya, with the support of our chairman Irai Vallal Dr. K. Sridharan sir, I do here by welcome the honorable chief guest, resource person, respected faculty members, and my dear enthusiastic students to grace this occasion in association with the Indian Pharmaceutical Association, South Tamil Nadu, local branch, Madurai, Tamil Nadu. Can you hear?
Yes, we are hearing you.
Yeah, we proud to have an eminent personality, a well-known administrator, and honorable chief guest, Dr. Niti Mathu, founder, global head, New York, USA, to grace this occasion. We thank you for kindly being the part of this session, madam. Your prestigious presence is a great honor for us and great motivation, inspiration for our students. Madam, we are fully appreciate for finding the time to be with us despite of your busy schedule. Welcome you, madam. Next, I am very delighted to welcome our distinguished personality, brilliant medical coding trainer, and our honorable resource person, Sri Chidambaram Saurirajan, Global Training Head, Neurosam. Let me acquaint you with the sterling quality of this eminent personality in medical coding trainer. Most welcome you, sir.
Thank you. Thank you.
Next, I want to extend my special thanks to my friend. I am very proud to say one of our alumni and he was my classmate, batchmate, Sri M. Arun Kumar, Senior Manager, Wipro, Business. Can you hear?
Yes.
Yes. Thank you so much. Thank you.
Wipro Chennai for a wonderful arrangement of this session. Thank you, Mr. Arun, for your kind support towards
Thank
the development of our students' career.
Yeah. Thank you so much.
Thank you, Arun.
Thanks.
Thank you. Next, I welcome all the professor, respected professor, faculty members, and my dear enthusiastic students for today's session. Dear students, it is gratifying to note that this session cover wide range of interesting topic relating to the medical coding, global practice and scope. My dear enthusiastic students, this session hope will enrich your knowledge and update you about the global medical coding. This is the first and foremost needed for your career. So I trust that every students will put their effort, put their effort to uplifting successful career. Once again, I welcome you all the very best for my dear students. Thank you.
Thanks, Dr. Venkatesh.
Thanks, Dr. Venkatesh. Thank you.
Thank you, sir. Thank you, sir, for your warm welcome. Now, I take the pride of introducing Dr. Niti Mathur, founder and global head, Neo CRM, and she has more than 22 years of healthcare experience and 13 years of US healthcare RCM industry. She has broad range of capabilities within depth understanding of Indian as well as US healthcare, experience in payer and provider domains. She is well exposed to mid-segment of RCM cycle and payment accuracy. She has did a MBBS in Delhi University and has continued her postgraduate in obstetrics and gynecology in Delhi University, Delhi. Currently, she is certified professional coder, certified outpatient coder, CPCP, and Dr. Niti Mathur is the vice president and medical director in US healthcare company. Dr. Niti Mathur is previously associated with Optum Global Advantage as director operations. She is a certified professional coder, APA HM, AHM 530, and she is also Lean and Six Sigma trained. I extend a red carpet welcome on behalf of Arundhati Kalaslingam College of Pharmacy. Now, it's my pleasure to share a few words about our eminent speaker, Shri Sauri Rajan sir. Shri Sauri Rajan sir has more than 22 years of healthcare experience with 16 years of experience in US healthcare RCM industry. He is expertised in the product development using higher end technologies such as artificial intelligence, machine learning, data science, deep learning, robotic process automation. He started his undergraduation in Madras University and post-graduation in diploma in medical lab technology in Loyola College, Chennai. Currently, he is the founder, trainer, Neo RCM, Emmet Logics, and is involved in developing a next-gen medical coding automation tool. Previously, he was associated with iSpace as Senior Manager, Operations, US Healthcare, Tire Side, Vendor Management, and Clients Agent Division, Rules Engine Product Support, and also associated with Cotiviti as Senior Manager Research. He is expertised in medical coding training, data analysis, process automation, business analysis, and project management. With these few words, I now extend Dr. Niti Mathur sir, madam, and Dr. Sauri Rajan sir to take the chair. Please, sir.
Thank you so much. Thanks, Dr. Sivakumar. So let me first start with a thanks note to Dr. Venkatesh, Dr. Anburaj, and Dr. Sivakumar for giving us this wonderful opportunity to virtually meet you all. And so we can go to the session. Let me present the. Are you able to see the screen?
Yes, sir. Yes, sir.
Yeah. So
Yes, sir. Yes, sir.
Got it. So with the introduction, we are now going to see the agenda for this session. So we will first see the difference between US healthcare versus Indian healthcare, and then we can go to details on what is meant by revenue cycle management, and in
Rajan,
particular,
can you be a little bit louder? Sorry to interrupt.
yeah, sure,
Can you be a little
sure,
bit louder?
sure.
Yeah, okay. Thank you.
Is it okay now?
Yeah.
Yeah, that's now
Great.
correct.
Yep. So after seeing the revenue cycle management, we will go into details of what is medical coding, and this is what the main core thing that we are going to see today, and what are all the opportunities in medical coding um, field, and what are all the certifications that are there available, and where we are, Neo RCM, and our contact details. So these are all the things that we are going to see today. And let me go for the first slide, the difference between US healthcare and Indian healthcare. Okay, so I think so. Everyone should be knowing about the health insurance, right? So everyone have Mediclaim. Okay, so at least in Tamil Nadu, almost like 60 to 70% population is insured by one or the other way. So that's what the stat says. So the health insurance is actually like they take care of the um, service. The providers will provide the service, and it is actually for a cost which will be not paid directly by the patient, and it will be taken care by the insurance companies, and for that the members will pay a certain premium, and based on which there will be a coverage. So this is what the insurance is. So we will go into details of what is this health insurance, and where the medical coding comes in next few slides. But as of now, we will see what is the difference between Indian healthcare and the US healthcare. So in Indian healthcare, the health insurance is optional. So that's the reason we are like in Tamil Nadu, there is only 70% who are covered. And in USA, it is completely contrasting, and it is mandatory there. Okay, so almost everyone in US citizens are covered by one or the other insurance, and the coverage by health insurance here in USA, all the visits, so regardless of whether it is an outpatient visit, a consultation, an admission to a hospital, so everything will be covered, and even the prescriptions, so everything is covered here. But in India, it is as of now only hospital admissions that are covered by the mediclines, and in few cases there are few commercial insurance companies who started providing outpatient visits also covered, but it is very rare. Like ICICI Lombard, they have some insurance plans which will cover the outpatient visits as well, but the premium is extremely high. Okay, so that's about the coverage difference. And if we come to a model, okay, so we call it as blend model, which means that everyone will be covered, but there is some difference between how they are covered. Okay, some are covered by the federal government, like whoever deserves. Okay, so will be covered by the government, and some will have commercial. So it's a blend model. Okay, so but in India it is almost I mean all the visits and everything are like out of pocket, so we have to pay. If you go and visit a doctor, we are paying them. Okay, so that's out of pocket model. And what is the difference in state wise? Okay, so in USA the policies differ state to state. Okay, they don't have um, a national policy. Okay, they have, but it is for a national insurance company. But if it comes to state, Okay, there are 50 states, so all 50 states will have difference in their policies, and how they administer also differs. But in India, like if you take Star Health Insurance or ICICI Lombard, whatever plan that they provide, so it is going to be like a policy for the entire country. They don't differ, because if it differs, then the complexity increases, and people who are willing to take this are not going to show much interest. So because this is actually a growing thing, so they don't want to take a risk, and they keep policies common for entire country. And if we come then what about for the deserved people? Okay, say for example, there may be poor people who cannot afford for mediclaim, and there will be aged people. Okay, so who means they are not taken care by, so those kind of deserved people, what USA have and what India have is, in USA they have federal insurance coverage. The government takes care of them, okay, by providing them the insurance. In India, we have government hospitals and primary health care centers. So this is the difference between the USA and India. So how they manage the poor people and the aged people who cannot afford the healthcare. So for them, so they provide insurance, and in India we have hospitals, government hospitals and PHCs. And the population covered. So this is interesting here. So this point is going to be discussed in more than one slides, the upcoming slides. Okay, so here if you see, it is more than 95% who are covered. Okay, but here in India it is less than 50%. Okay, so that is how it is, and this is where the importance of revenue cycle management, medical coding, all comes into play. So we are going to see this in the upcoming slides. Okay, so moving on to the next. So this is what I was telling about the patient, provider, and payer. So this is actually, we call it as 3 Ps. Okay, so patient, provider, and payer. So patient goes to provider for the treatment, and provider provides the service for the patient. The treatment is called as the service. So they provide service, healthcare service for the patient, and the patient pays a premium, okay, to the payer, so that patient can go and get their service cashless. Okay, and the payer will take care of the reimbursement for the provider. So whatever service that provider provides will be reimbursed by the payer. And
Jen,
yeah.
I'm
Yes,
sorry to interject, but perhaps I'm not sure about whether they'll understand provider or peer. So maybe you could just, so
Yeah.
the provider is,
The physicians. So provider will be the physicians, or the pharmacist, the physiotherapist. So all those who provide service are going to be the provider, and the payer is actually the insurance companies, okay, who get the premium from the patient and provide reimbursement for the service that they had taken from the physician or physiotherapist or whoever it is. Okay, so this is the service provider. The physician is the service provider, and the insurance company is the payer, and we all know who is patient. And if we come up with, a question of who are all the payers in US healthcare. Okay, so payers are insurance companies, and Medicare and Medicaid are the federal insurance companies. Okay, the government insurance companies. Medicare is national, and Medicaid is state, and commercial insurance is actually something like we have Star Health, we have ICICI Lombard. So these are all the commercial insurance. So they go for a little higher premium, but they cover more services. So that's how the commercial insurance works. And what are all the challenges? We are going to see the challenges and what is the solutions in the upcoming slides. Okay, so going to the next slide. So what is revenue cycle management? Okay, so the patient goes and get treatment from a physician, and the physician is going to get the reimbursement for the service provided from the insurance company. Okay, so this is, though it looks simple, there is a lot of documentations required, because the insurance company who gets premium from the patient and reimburse the physician is going to require a lot of documentation from the physician. So what is the service that is provided, and when it is provided, to whom it is provided? So all those need to be documented very clearly, so that the physician gets the reimbursement from the insurance company. So the documentation is going to get more importance here. So if we see here, so this is the encounter. So doctor is visiting the patient, and what happens next is actually the documentation. So all that happens in this encounter. So they are going to first understand what is the chief complaint for which the patient came here, and they understand what is the past medical history for this particular patient, and they do the physical examination, and they assess, and if they want to do some diagnostic tests, they will do that, and based on that they will provide a treatment plan. So these are all the things that happens. Not only this, and there will be surgical services, like if a patient requires a surgery, so that happens. All these are called as the service that are provided to a patient. So once the service is done in this encounter, those service, whatever that happened here, will be documented. Okay, so that is the documentation that happens. Okay, so the documentation is done, and where it goes next is actually the medical coding department. Okay, so we are going to see what is medical coding in detail. Okay, so why we need to have medical coding and medical billing? So medical coding is something that converts, okay, the document into codes. Okay, why we need to do this medical coding? Because, say for example, if you had seen 2 slides before, I had mentioned that it is like 95% people are insured. Okay, so they have mediclaims. They are not going to provide cash for the provider. Okay, so in US population, 95% are like this. So they are all for cashless visits, and the documentations. So how many documentations will happen? Okay, so all the encounters. Say for example, if there are millions of visits that happens. Okay, there are millions of doctors. Okay, so in US, and all those, even if they do like 10 visits per day, then there is 10 million documents, and all these 10 million documents, if it goes directly to the payer, it is going to be very difficult for them to go through this document, understand what is the service that is provided, and then do the payment. It is going to take a whole lot of time, and also for reviewing this encounter documentation, they may need skilled professionals, maybe a doctor, okay, to understand what is the surgery that is done. So some healthcare means whoever is having that healthcare background, the professionals only can understand what happens here. Okay, so this is going to take a whole lot of time to get the reimbursement. The provider gets the reimbursement after a long delay. Okay, so that is the biggest challenge in US healthcare. So for that, they came up with medical coding. Okay, so here the document is converted to codes. Say, for example, this is a service. Service is provided. For that service, there will be a code, something called CPT, okay, current procedural terminology. So the service is actually called as a procedure that is done by the physician. So the physician, the documentation will be converted to a CPT, and will that be sufficient for the reimbursement? The answer is no, because the procedure is done. Okay, but for what the procedure is done? What is the medical necessity for the procedure that needs to be done? Okay, what is the need for the patient's visit? There should be a medical necessity, right? So for that purpose, there is something called diagnosis coding. So we had seen procedure coding, which we call it as CPT, and there is a diagnosis coding. Okay, diagnosis is like ICD. They call it as ICD, International Classification of Disease, and we go in US it is called as ICD10 CM with clinical modification. Okay, so US ICD10 is actually published by WHO, World Health Organization, and it is modified for their requirement, US requirement, and that data set is called ICD10 CM. Okay, so it is not only the procedure, whatever that is done should be documented or captured. It is also the medical necessity that also need to be captured here. So CPT and ICD codes are captured by medical coding team. Okay, so this is the biggest challenge, because the documentation, there are millions of charts, and all those charts need to be coded. Okay, so it can be a like 3-page or 4-page or even 30-40 pages, but there will be only one procedure code, and there can be multiple diagnosis code. Okay, n number of procedure code and n number of diagnosis codes. If they miss procedure code, the physician is going to lose the reimbursement. And so there is a very much importance in the coding. Okay, so the CPT, we understood the importance, and if we come to ICD-10, so ICD-10 is another coding, the diagnosis coding, without which the CPT will not be paid. If there is no medical necessity, say for example, if a patient comes with a knee fracture and the fracture reduction is done, here the CPT is for the fracture reduction. Okay, and if a coder codes like fever and cough for this fracture reduction, will that get paid? The answer is no, because that is not a medical necessity. Okay, so there should be a fracture code for the fracture reduction. Otherwise, it will not get paid. So that is the medical necessity. So all these are done, and then once the coding is done, it will be in an application. It will be submitted as a claim. Okay, so once the coding is done, there will be medical billing people who codes this. Okay, so who will enter all these codes to a medical billing application. So once this medical the codes are added to the medical billing application, once it is submitted, a claim is generated. This is an electronic claim that is generated. So, because manually if they do and submit paper claims, it is going to take again that paper claims need to go all this process, and then the adjudication is going to be difficult, because only electronic claims can be automatically adjudicated. If it is manual, then that needs to be entered in the payer side, so it is going to take a lot of time. So almost all of the insurance companies are mandatorily following this electronic claim submission. Okay, so most of the claims, at least 90% of the claims that are submitted in US are electronically submitted. So once it is electronically submitted, it is automatically adjudicated to some extent. We say like first level of adjudication. The adjudication is nothing but a claim is submitted, so somebody have to review that claim. As I said, if there is a fracture code and if there is cough and fever as diagnosis, then will that be paid? No. The answer is no, it will be denied. So the payment and denial happens in the claims adjudication. We call denial of a claim or payment of a claim is nothing but claims adjudication. Okay, so they adjudicate, they take a decision of whether to pay a claim or deny a claim. Most of the insurance companies will have auto adjudication, and that will be the first level of adjudication. So all these CPT and ICDs are minimizing the review time. Okay, so with this CPT and ICD, they can adjudicate to some extent, because procedure code we have and the diagnosis code we have medical necessity policies based on which the system can auto adjudicate to some extent. Of course, there are some complex charts which cannot be adjudicated automatically. So those will go to the manual adjudication. Based on this claims adjudication, there will be payment happens. Okay, so the reimbursement happens, whether to pay that claim or whether to pay that claim partially or whether to deny that claim. So all those decisions are happening here. And if it is a payment, then reimbursement happens, and that goes to the provider. So this is completely called as revenue cycle management. Okay, so whoever is having any questions, please put that on the chat box, so that during our Q&A we can address most of your questions. Okay, so next is actually the medical coding overview, and there are like 37 countries who do medical coding. We all know that it is only, we all know that in US they do medical coding, but there are other countries as well, okay, who do medical coding. We have medical coding in India, okay, but the difference between medical coding in US and medical coding in India is actually US do this for financial purpose, because the reimbursement happens based on whatever codes that the medical coders provide. Okay, so the importance is extremely high, because if they undercode or overcode, it is going to be a problem for the provider. But in India, the medical coding is there, and it is actually the data set what WHO provides, World Health Organization provides, which is ICD10. Okay, so the ICD10 will be done, but it is only for the statistical purpose. So with this, we can say that, okay, this many people are infected by COVID-19, and the COVID-19 have ICD-10 code, and in this particular state, there is prevalence of this particular disease. So this is actually for statistical purpose. Okay, and in other countries, there are several countries who do medical coding other than US and India. Australia does that, Germany does that, and there are several other countries. New Zealand, sorry?
UK.
Yes, UK does that, and New Zealand. Now the Gulf countries, Saudi Arabia, Qatar. There are several other countries as well. There are 37 countries as of now we have who do this medical coding, and there is a huge opportunity not only in US, but it is a global thing. Okay, the opportunity for medical coders is global now. So these are all the code sets. We discussed about CPT and ICD-10 CM. There are modifiers. We will add, this is a 2-digit code. We will add it to CPT, Modifiers are there. There is something called HICPICS and there is something called DRG. So professional and facility coding. Professional is actually for the physician's service. Okay, and facility coding is for the hospital who provides that service. Okay, so what is the difference between these two? Is actually professional is actually let us assume we go and take a chest X-ray. Okay, so chest X-ray is done in a facility. Okay, so radiology facility, and the film is taken by the radiographer and it is shown to a radiologist, a physician who can see the film and interpret it. Okay, and he will provide a report. Okay, so here the professional service is actually the interpretation of that film. Okay, a radiologist does that, only professionals can do. So that is actually the professional coding. Okay, so coding only for the physician's service. Here the physician service is interpreting that film. Okay, and the facility coding is actually the radiology, the radiographer and the X-ray film. So the facility that is used. So all these comes under facility coding. Okay, these two are two different coding. Okay, this is done by the hospitals and any radiology means team. So those radiology facilities, they do this facility coding, and the professional coding is actually for the radiologist. So this is an example for this, and this is there in each and every department of healthcare. Okay, and for professional coding we use HICPIC, CPT, ICD10 CM and modifiers, and for facility coding we use something called diagnosis related group. If a patient is admitted, we use this coding. Okay, and ICD10 CM is common in both professional and facility, and ICD10 PCS is procedural coding system, and this also differs for the inpatient and the facility coding. And there are other code sets as well, which we can see in detail later, which is MEDRA and LOIN. This is not related to the US healthcare, but it is related to clinical trials and lab test and any diagnostic test. So these are the other code sets that we have. And this is actually a sample chart that I'm providing. So this is actually a CT scan of abdomen and pelvis without contrast. Okay, and this is what the indication is, and this is the impression of that. So what I have highlighted here is actually the procedure code. So for CT abdomen and CT pelvis, for CT abdomen it is 74150, and CT pelvis is actually 72192. For this, these are all the medically necessary diagnosis codes. Okay, so without these diagnosis codes, it doesn't mean that only this diagnosis codes, but there should be some relevant diagnosis codes that needs to be added to get this paid, get this CPT codes paid. Is there a payment for ICD code? The answer is no. Okay, but without the ICD codes, CPT will not get reimbursed. Okay, so that is what we need to understand, and I have highlighted like pericardial effusion. The code is I31.3. Bilateral lower lobe infiltrates, it is R91.8. We have, even for the pandemic, the COVID-19, we have codes in U series. So we have codes for each and every diagnosis, and there are around 72,000 approximately the diagnosis codes, and there are around 25,000 procedure codes, out of which we have to select the coder have to read this document completely, and for getting these CPT and diagnosis codes. Okay, so Niti, would you like to take from here?
Oh, yeah.
Yeah.
Yes. And thank you, Rajan. And in the interest of time, I noticed that we have just around 20 minutes left. I will skim through quickly.
Yeah.
So medical coding, and I hope you've understood as much as till this point to understand, why. So the question that comes to the mind is like, why are we even doing it? Why is it so necessary or essential? Because a lot of money is being paid to these coders to code. And so one of the reasons, there are a few reasons actually, but probably the most important one is that there is a need to reduce the administrative burden. Now imagine a scenario where we would have, where we wouldn't have claims, but all these millions of files, the patient charts would actually physically be transferred to somebody who would then flip through pages and pages and pages, and to come to a decision about whether they should be paid or not paid. Now, to avoid that, what they've done is concise the whole thing into a beautiful electronic form, standardize the way in which they deliver the information through CPTs and through the CPT ICD coding and other forms of coding, depending upon where it has come from, who is providing the service, etc. And so there's a dramatic reduction in the burden of the load, and the time taken for the execution of the payment to the doctor. So what is the purpose of all this? The purpose is that the money has to flow very quickly from the insurance company to the doctor, right? Because if the doctor doesn't get the payment on time, he's going to say, no, I won't treat the patients. And he's going to take a step back, which we don't want, right? So there's timely payments to the physicians in the hospitals. There is standardized and seamless RCM workflow. Everything is just caught in an extremely systematic manner. Oh my, if RCM is a train, then medical coding is the engine that drives it. Okay, wonderful. So it is, medical coding is almost at the center of things. It's a very important function that happens, that kind of bridges the gap between the payers and the providers or the doctors. So next slide, please. Okay, and then another very important, kind of function is that what it ensures is that all doctors get paid the same amount. Okay, so they have a rate list, and then the claim goes and bounces against a rate list, and through the rate list, an equal amount of money is given to all the doctors, depending upon what the service is and where the location is. But the idea is to create standardization. Now imagine if they didn't have claims and if they didn't have medical coding, and if they didn't have these payment, these rate lists, what would happen is, maybe Rajan could get paid $200 for something, for a service that he has rendered, and I would be paid just $100 for the same service, without there being remarkable. So we could be in the same area, but there's no way to equalize the payment. So one of the very important functions of why coding is important is because it serves to optimize the reimbursement. Okay, and then there is, and why is correct coding important? Because if it is not correctly coded, so what is the role of the coding community? It is to ensure that correct coding happens. Now, if a high reimbursement procedure is undercoded, right? So let's say I've done a very complex procedure, but my coding is incorrect. My coder doesn't code properly, and he codes for he doesn't understand, he doesn't read whatever is there in the patient chart, and he ends up with using a procedure code that pays far less. So my payment gets impacted, right? So that is the concept of undercoding, and that is why coding needs to be very accurate. People who code are extremely skilled, extremely technical people. They understand what the doctor is doing and ensure that the doctor gets the correct payment, either from the payer or even if they're coded. So there's a provider coding and there's a payer coding, but essentially the good work of these people results in on timely payment to the doctor. Overcoding at the same time can result in a drainage on the on the payer system, on the insurance companies, because they'll end up paying more for something that they shouldn't have. Next slide, please. And so then, who are these very important people? What kind of people are actually the candidates who should be learning this? Essentially, they are life science graduates, BTech, BE, biomedical engineers, or sometimes it's, sometimes people have a slightly tangential way of entering these medical coding services. So they come through billing into coding. They first understand billing. Billing is the process where they attach charges to the code. So they start with billing, and then move into coding. Or sometimes they even, there was a time in India when they started with transcription, and then the transcription industry then slowly transmutated into the coding industry. So there are various types of people who are a good fit for this kind of a career. And fortunately for you, next slide, please. Fortunately for you, and this being a pharmacy college, a lot of, almost all of you actually are perfect candidates for taking this up as a vocation. So why do you have an advantage? Because you're familiar with the medical terminologies, and I understand that you understand anatomy, you understand physiology, you understand pharmacology, right? You understand the concepts of dosing, and you know what a patient chart looks like. You're already kind of the perfect material for moving into this kind of career. So that you have good analytical skills, good logical skills. You can understand what a physician is trying to do or trying to say, and which is why this is kind of just the right career option for people with a pharmacy background. Next slide, please. Along with pharmacy, there is also this subset of people who are very good candidates. They're people who have a nursing background because they understand the ins and outs of the hospitals, they understand patient management, physiotherapists, occupational therapists, of course, all kinds of doctors, whether they're MBBS, BAMS, BHMS, and so even if you have your friends who are in these allied sciences, basically, they could also be pulled in. People who do biochemistry, microbiology. Some of so not everybody will be on the same kind of page. Some of these careers will have a slightly longer learning curve as compared to the others, but for most part we have found that this is the correct skill set to move into this vocation. Initially, when this industry had started, a lot of people, next slide please, a lot of people had come from other branches as well, BCom, BA, because nobody really knew what it was about. But over the period of time, and now this industry has been around for a good 20 years, close to 20 years in India. And what we have discovered is that actually people who have a good scientific kind of a background in life sciences, and who have exposure to hospitals are the ones who can then go into the depths of the technicalities, and they are the ones who are the good coders, as compared to others. Some of them, of course, other professions also. I mean, it depends upon the individual, right, at the end of the day. But if you just look at it on an average basis, this is definitely the thing. Okay. And so you say, okay, I take this as a vocation, Dr. Nidhi, but then what's going to happen to me? Right? So where do I head? What happens in a corporate? So in a corporate, you see that pyramid. So there are maximum number of people at the bottom, and as you go up the pyramid, actually, you're rising in seniority, and then less people at the top, right? And I'm sure everybody knows this. So and as you could start as a coder, and those different levels that you see over there, so some 10 or 11 levels would take you right up to at the top of the pyramid, to be to a business unit head, basically. So and that's a very powerful position. It commands a lot of the business. So next slide, please. So and there is more way than just one in which coding gets applied once you enter the corporate world. So there is, there's pure operations. You saw that pyramid, so that is an operational pyramid, okay? But some of the people who know coding, after they become quite senior, actually branch out, okay? Just like you do your B farm, and then you start doing your M farm, and then you have those various M farm, specialties. Similarly, coding also branches out, and it has different specialties. So some of them do quality control, some of them get into training, some of them get into research and development. A lot of them are needed for healthcare analytics, business analytics these days, and analytics is on a high. But they need people who can look at the claims and understand what the output is, or tell them, let's look at this, let's look at that. Depends upon your level of seniority, but the scope is astonishing, and it's something that even I had not realized when I started out. So when I'm a doctor, and I don't really need to do coding, but I did. And would you believe it, when I did it? I did it last year. So I'm still an apprentice. There's a CPC apprentice. I'm still an apprentice. I'm kind of a junior coder if you look at me from a coding standpoint. And there's a reason that I did it, because I felt that it brought me value add, and it did, both in terms of my professional growth, my technical growth, in terms of my monetary growth. It's a huge add-on. It adds to my CV. I'm not a fool that after having so many years of experience, all of a sudden I say, oh, let me do a CPC, unless it has a value. Go ahead, next slide. And I think Rajan has already talked about this a lot. This slide basically displays what a huge industry it is. It's at $11.6 billion in 2018, and expected to grow to 22.95 by 2025. So it's a growing industry, and it's a good time to capitalize on this, on this vocation. And we know, because we are internals, right? I mean, internal to the corporate world, so we know that there is a demand. There's a very high demand that needs to be met. A lot of the US healthcare companies, and all over the world actually now, outsource to India because they find it cheaper. And for Indians, we are service-oriented people. We just know our stuff. Doesn't matter whether we are doing it for the US or for any other country. Now, interestingly, our healthcare budget for India also has gone up. In fact, this year we had a huge infusion. And remember that insurance, while right now is not so dominant in India, but it is expected as a trend. It is expected that the penetration will increase. I mean, we've seen in COVID. I mean, there was a huge impact. So many people suffered, and we lost so many lives. Lots of them were not insured, and so, as the realization seeps in, the amount of insurance coverage is going to increase. As the amount of insurance coverage increases, we are going to face the same issues that US did 50 years ago. And we're going to start doing the same things, which means that medical coding will have a future in India. So if you get in now, 10 years down the line, I mean, we could get in now with US healthcare, but 10 years down the line, or maybe 15 years down the line, you would be an extremely skilled, extremely senior coder who maybe operates in India. So that's the opportunity. both onshore, offshore. Onshore is as in onshore is when you talk about US, and offshore is anything away from the US. Next slide, please. And these are some of the companies. You may have heard of them, you may not have heard of them. We just thought that we should have a slide around. Even your Madurai has Buddy Healthcare, and this is turning out to be extremely popular kind of a alternative for people with your kind of background, specifically because right now, like for example, I'm a doctor. And much as I have, my sense of that I need to serve in hospitals, maybe let's say I'm a surgeon, and then, but right now because of COVID, there is no surgery happening, or there's very extremely, limited surgery happening. Only the emergency surgeries are happening. Where am I supposed to get my money from? This is the alternative career that you have. This career is what you can capitalize on, and believe me, I've done it. I have worked in a clinical environment and then made this shift. It was a difficult task. Don't think that this is going to be easy, because it's not going to be easy. You have to learn. You have to push yourself. Okay, but it is worth the while. Next slide. And so you'll be interested in, okay, so how much does it pay? And on the left, you see this little box, and we have two columns over there. The first one is, year one of experience, and then roughly, 5 years of experience. What people get paid, okay, is put right up there. Now you will notice that the money changes according to, notice the factors. When your level of experience increases, excuse me, as you move from your first year to your fifth year, in each one of those rows, your value goes up. Excuse me, your value goes up. As you move from a non-trained category, excuse me, to a trained category, your value improves. Excuse me, I got a frog in my throat. And then, it's okay.
Yeah.
And then, see, I was non-trained. I didn't even know about training, okay? So I was non-trained. Then I moved into trained coder because I learned coding through in-house. So corporate was doing some in-house training. They were teaching their own people. I joined that. I became a trained coder. And so my value shifted. But then I said, okay, let me get a certification. Okay. And I got a certification, and my value increased further. So you can see in the third row, 15,000 to 18,000 is the start. And then 35 to 38 is an approximate range. Okay. We are not saying this is it, but these are averages. These are industry averages that we are reflecting here. And then the fourth one is the specialty expertise. So you have a common sort of a certification, and then you really specialize in, let's say, a cardiology or a radiology, and then you really become like kind of very niche. You become very niche and very premium and extremely, people are just waiting basically in a queue. On the right, you'll see that there's a bit of a correlation between how much you are learning to how much you are progressing. Right? Now, many people, and because you're students, and we're almost on the end of a time, because you're students, you must realize that many people think that a job is your career. A job is not a career. A job is a job. It gets you your money, okay? Your career happens through your basic skill set. And that is what you always need to kind of build up, And remember that throughout your life, I mean, regardless of this particular session, that will decide where you go. Today, I'm a vice president. Why am I vice president? I mean, okay, obviously, there must be some merit, but it's also because I'm a doctor. It's also because I push myself. You heard my certifications, right? I keep on pushing. I keep on pushing. Every year or 2 year, I have a target. Every year, I have a target. I have to clear something. Okay? Next.
So I can take this from here, Neetu. You can have some water.
Thank you.
Yeah. So medical coding certifications. So why we need a certification? So as what you see in the last page. So you are seeing that a coder with certification is valued more. Okay. So their salary will certainly go up with the certification. And even for specialty, there are a lot of certifications. The main two organizations who provide certifications are AAPC and AHIMA. They both are in US. So they provide the AAPC is American Association for Professional Coders. So these two organizations provide all of these certifications. So CPC, COC. CPC is Certified Professional Coder. COC is Certified Outpatient Coder, and CPCP is Certified Professional Coder Payer Side, and CAC is Certified Inpatient Coder. So these are all by the organization AAPC, and CCS is by the organization AHIMA. So these are all the few certifications, general certifications. And if you come to specialty certifications, there are at least 50 certifications. Okay. So they have for cardiology, they have for radiology. So if you see this example, this is actually certified interventional radiology and cardiology coding, and certified risk adjustment coding, and there is evaluation and management coding, anesthesia coding. So there are a lot. Okay, so you can whichever that you prefer, because you have your own preference. So based on that, you can take any specialty certifications, and with that, you can means decide on your career growth, as well as the means you will get a good salary as well, based on whatever certifications that you are completing. Okay, so this is about the certification. And the corporate advantages. So there are now most of the companies are corporate companies, and the minimum salary for any corporate company will start mostly within 10 to 15,000, and it is always a 5-day week culture. So you will get a weekend off, and yearly performance based appraisal, which will range actually from 8 to 30% based on your current basic salary. And there is a lot of growth opportunities, as you had seen in the previous slides. Either you want to move vertically or horizontally. Vertically is actually in the operations itself, like coder, senior coder, and then as a team leader, and then a manager, assistant manager, manager. So that is vertical growth. And if you want to go into horizontal growth, uh, you can go to QA trainer, and if you want to go to research and development, or if you want to go as a business analyst or process analyst. So all these are horizontal growth. So whatever that you prefer, if you go and join a corporate, you have those opportunities. You can go to any of this. Okay, if you want to grow vertically or horizontally, you have opportunity. And the atmosphere is always friendly, and you can have casual attires, and there is corporate social responsibility activities. Most of the corporates will have, and you can go to villages, and you can um, go to orphanages, and there is an amount that is being secured for this social responsibility, and you can spend that for this kind of social activities, and there will be fun Fridays. So each and every corporate will have their own way of celebrating the success or celebrating with the employees. So these are all the benefits, and they all provide a family health insurance, and they have group health insurance, that is Mediclaim. So you will get all these benefits. Basically, you will get all these. Okay. And the growth mostly is unbiased, and the work environment is safe, and you can voice your concern. Okay, there are proper channels. So if you find any issues, you will be means in the when you join itself, they will provide all those contact details of if there is any issue, to whom you have to contact. So all those are actually corporate advantage. And now the last but not least, here it is not mentioned, is actually the work from home concept. Thanks for the pandemic. So this is the only positive thing that happened. The work from home concept is majorly there in these corporates, and almost 100% are working from home now, and the corporates are looking at all the advantages. It is not only an advantage for the employees, it is an advantage for the corporate as well. So they are looking at it, in case if it is going to be mutual, then they may continue even after the pandemic. So that is what is currently expected, because they are paying a lot for the facility, and they have to pay a lot for transport and all the other logistics. But now asking people to work from home, they are gaining a lot. So corporate is keenly looking on this, and I think even after pandemic, there will be certain corporates who are going to continue with work from home. So coming, this is going to be the last slide, and before our contact that is provided. So Neo RCM, if we take, we are the means we are evolving, and we have industry experts as trainers. We not only have full-time trainers, we also have guest lecturers who can come and provide certain specialty related training. So those training will be provided, and certification training for experienced coders, we provide that as well, and any certification. So I had shown you a slide where I had given all those certifications and specialty certifications. We are providing all those certification training, and the cross specialty training for experienced coders. Say I'm doing radiology now, and I'm very much interested in anesthesia or evaluation and management. Yes, so there is an opportunity. So and if you have in your corporate, you have all these specialty, and you want to move, then you can undergo the specialty training, and you can move towards whatever that is interested to you. And also last but not least, the placement assistance. So we have affiliation with a lot of human resource departments of several corporates. So we should be able to assist you on the placement as well. So here is the contact detail of mine and Dr. Neeti. So you can note this down, okay? And so you can feel free to contact anytime, okay?
Martin, so just let this slide be while they take down the contact details, and maybe we can open up for a question and answer
Yes.
session.
Yes. So you can open the meeting, Dr. Anburaj, and I'm open to any questions from the group.
Sure, sir.
Yeah. Or is there any in the chat box? Anybody had sent any questions?
So not yet.
Okay.
So if you have any doubts, kindly ask.
No questions? Everything is crystal clear.
No, if I start asking, then people may start asking questions. So
You
let
have
me
to.
start. Let me start with a question.
Yep.
So, fine. Let us say I am a pharmacy graduate who is completing my 8th semester, because we do have semester systems. I am doing my 8th semester. During the 8th semester holidays, can I do the training so that I'll be either trained or certified, so that once the result comes, I can apply for a job? Is that possible? And when soon are you trying to start a batch?
Arun, we are starting a batch coming Wednesday, that is 16th. So the batch will be started, and so we have all kind of flexibility. Okay, so we have weekend batches and weekdays batches, and we are far more flexible for any timing. Okay, so however they want to have their timing flexible, we should be able to do that. For means based on their availability, we should be able to do that.
Right. And the second part of the question about whether somebody who's in the 8th semester, not really passed out, pre-passing, can they enroll? Yes, they can. There is no mandate about that you cannot enroll. So in fact, it kind of readies you. If you could, do it side by side with your studies, it would just ready you for uh, applying for a job once the
Yes.
minute you're out. So it's actually a very good proposition and very good question. Thank you, Arun.
Thanks, sir.
What would be the time frame to complete a course? Let us say I start as a general coding. Uh, uh, is it an online 8 hours training for 20 days, or is it a 2-hour training for 2 months? How the course is defined?
Yeah, this is actually a 6 weeks course, Arun, and it is going to be 2 hours every day and 5 days a week. So that's how we have done. And as I said earlier, we can be flexible, and we have weekend batches as well. So in case if somebody is interested in weekend batches, we should be able to enroll them as well. And
Okay.
the timing is also is going to get reduced.
Subject to the condition that we have a minimum core of people. Like if there's just one person for a weekend batch.
Yes.
So sure. Did you say louder?
No, somebody else asked the question.
Okay. Yeah.
I'm curious to know about certain working professionals. Say, for example, I am working as a lecturer, or I started my career as a teaching faculty, and I do get free time in the evening. Say, for example, 6 to 9 in the evening, or early morning 6 to 9, because my college starts at 10 o'clock. Can I do this course and utilize this as an opportunity for a second source of income as a part-time? And how progressive it is going to be in the future, that many companies are trying to come up in Tamil Nadu?
Absolutely.
Go ahead.
Absolutely. Could you please go on mute? Yeah, thanks. So that is wonderful. So this is not only, look at the range of people who can get engaged with this, right from the time, when you're kind of nearing completion of your courses, to even senior people who are looking in for part-time opportunities, freelancing opportunities, contracting, specifically given the fact that now we have a remote working environment. I mean, you just do this course, enroll as a freelance worker with some company, and you work for 2 hours every day, and you walk away with the benefits. So this is the kind of additional thing that you could choose as a full-time career, you could choose as a part-time career, you could just do for a little bit of pocket money. So there's a range of objectives that could be met depending upon your own personal circumstance.
Thanks for the explanation. I think there are some questions as soon as I started asking questions. There are some.
Puja, go ahead.
No, there is, I think it is Mari Selvin.
Marvi Selvinta.
Yeah. So I have a doubt now. I am in 7th sem. Now can I join the training? And once I completed my training, can join as a part-time work? The answer is yes. You can join, and means if you get a part-time, yes, you should be able to. And now there is a whole lot of part-time work that is coming. So the answer is yes for you, Mari.
But remember that your main focus should be on clearing your pharmacy exams. Don't get distracted by, an opportunity to earn money and to train yourself. This is in addition to your normal,
Yes.
basic. Yeah.
Okay. Do you have any kind of referral system? Suppose I join the first batch, and I do give some referrals for the second or third batch or the subsequent batches as soon as I get placed in a company or something. So do you recognize me, and what is the scope of Neo RCM becoming a company recruiting people?
Can I take this?
Yeah.
Okay. So we are going to get some projects soon, Arun. So we are looking for projects as well, the coding projects, not only coding, any kind of healthcare related outsourced projects we are willing to do, and we have a infrastructure already in Chennai. So we are looking for projects. In case if we are getting a project, yes, as a company we are going to recruit, and the preference will be given to whom we have trained. So that's how Neo RCM works in future.
Okay, thank you. I think Mohammed Ismail has some other question.
I think
do
he also
have
had the same, yeah.
same doubt.
Same doubt.
Okay.
So
as
my
you said-
doubts are clarified, and it's open to the management.
So as you said, so medical coding is a process of coding diseases and prescription and all. So now there's a emerging field is going on, artificial intelligence. Like there are a lot of automation is going on.
Yes.
If a software has been introduced, like if you see a Google Translator, which is replacing guides as those who are involved in the translation. So what is the future of this medical coding, sir? Because a lot of automation and artificial intelligence, how they influence this profession?
That's an excellent question. I think Rajan is the right person
Yes.
to answer robotics and artificial intelligence, because he has been working in this automation process for close to 7 years. So he may well explain. That's a good question. What is the name? IVLS? What do that mean?
This is Anburaj.
Dr.
Anburaj.
Anburaj. Okay.
Yes. That's a good question, Dr. Anburaj. So I am working on artificial intelligence. I am working on natural language processing, robotic process automation. So I do have experience, and I am working on a product. Emed Logics is actually a product that we are building for automating coding, but it doesn't mean that it is going to replace coders. So that is not at all going to happen, because a coder cannot be replaced by any chance. Okay, because yes,
it is too interpretative to, it's not exactly as in, it's not a very boxed in kind of a thing. So one, the audit function of the output of AI will always remain in place. Second, if you notice us, so look at Rajan, he is helping to develop that artificial intelligence product, and he's a coder. Right? So these are the kind of indirect applications of the coding community. So not everybody is going to be just doing simple backend coding. That's a start point. Once that platform is established, there are multiple ways in which the progression happens. I hope that answers your question.
Yes, madam. There is a
Yep.
question in the chat box.
Yeah, I have a doubt. It is possible to learn coding language of different specialization areas like cardiology, endocrinology, etc. The answer is yes. There is a whole lot of specialty, and we have certifications for each and every specialty. So whatever that is your interest, we should be able to guide you and get those certifications. So that is the answer for Sachin. And Dr. Tamil Jyoti. So it is actually skills or quality to be improved by our students during their study duration to enter into MNC company. Yes, it is, but means you will get that and you will learn that. Okay.
I will.
So,
Can I pitch in for 1 minute?
Yes, Arun.
To both Sachin and Tamil Jyoti. Tamil Jyoti has got an excellent question, because what we generally face in the southern part of Tamil Nadu is they understand very quickly, they grasp things very quickly, but the thing they interpret and the way they communicate to expose themselves is little bit inhibition is there. That is the only thing that I found out in. I am a passed out student of 1998 batch. So I have developed my skills of interpersonal relationship skills. Suppose if you want to attend a multinational company, how well you should be prepared. So I can help you out, Dr. Tamil Jyoti, for all the students in Kalasalingam College as a student, as an alumni. I can come and give a lecture of soft skills they need to develop. Right, during the 6th or 7th semester or 8th semester, I can definitely come over there and give a lecture about what kind of skill set do you need to acquire to crack the interview of an MNC. Though you are well equipped with training, whatever the CPC coding and other things, the way you project, the way you present yourself in the interview for 10 minutes matters a lot, because you are not going to be evaluated or scrutinized for 2 hours or 3 hours. The 10 minutes interaction is going to decide whether you are going to get a job or not. That skills I can definitely come over there, and I can teach, I can mentor the students how to crack an interview. And for Sachin's question, yes, in general coding we cover all the departments. Say for example, when Rajan said about current procedural terminology, it is divided into 12 sections, where anesthesia is one section, cardiology is one section, but we cover all the things in general during the general coding training. So I think that answers Sachin's question. In general coding, all the specialities are covered, but if you still want to specialize in that particular specialty, then there is a certification. To be very clear about what I am trying to explain.
Thank you, Arun. Thank you.
And one additional information on that is, in my experience, what I had seen in my team, so almost 70% of the highly skilled coders are from the south. Okay, when I was working in Chennai, so I can see that. So the Chennai people are very minimum, and people from Madurai, people from Tirunelveli, Virudhunagar. So there is a whole lot of people, and they are very strong in the content. The only problem that we face is the communication.
Communication.
So yes, that is the only place. If they improve, then there is nobody can stop their career growth.
And I have actually been
help
part of meetings where the clients have been very clear about the fact. I mean, South India has such a reputation of discipline, which is what they really respect. So they are like, because of the culture of discipline, and this is back end, right? So even if you don't speak too well, or maybe your accent is not, if you're heavily accented or whatnot, if your understanding of the concept is clear, you understand, and you're able to attach the correct codes and make the correct interpretations, that is what they want. That is all that they want. And so a lot of companies now are shifting down south, so less towards central and North India, more towards South India and a little bit around Ahmedabad, a few in Chandigarh.
Okay. The other flip side of the story is it is not going to be as easy as a cakewalk once you are into your production mode. Say, for example, Rajan has given one particular chart where we need to interpret the medical record within hardly 60 seconds, and you have to code it. So that is the skill set they need to develop. Say, for example, in radiology, the target for a medical coder is between 600 to 900 for 8-hour job. That means that you need to code minimum 80 to 90 charts in 1 hour. So that is the skill set that you need to develop to answer Dr. Tamil Jyoti questions also. It adds up value. You need to have good typing skills as well.
Yeah.
Sir, I think coding is a part of a BPO, right?
Yes. Yeah, it comes under BPO and IT enabled services, ITES.
So, yeah,
And
there
is a forum called NASCOM. NASCOM is the National Academy for all the IT and IT related services. And the chairman now is from HCL or some company. So there is an organization which governs all this IT and IT enabled services.
Yes, sir. So if you go through many job websites, so there are a lot of terminologies like transcriptionists, medical coders, billing executives, or insurance specialists. So what is the difference and how this medical coding is different from these arenas? Like
no, all these come under revenue cycle management. That what Rajan explained. Even if it is a medical transcription, so let me give a startup point. The medical record is converted into transcribed medical record. The transcribed medical record is converted by a coder into digital number, and the digital number is being converted into or posted in an application. That is a medical biller job. And once the medical billing is there, then there is an insurance specialist where he agrees or rejects the claims. So all these 4 departments comes under revenue cycle management, RCM. That's why we have named the company as Neo RCM. Neo is nothing but we are evolving, and RCM is revenue cycle management. So all these come under RCM.
Okay, sir. The same again. The job portals, there are a lot of vacancies are coming in medical transcriptionists or medical coding. 5,000 coders are required, 6,000 coders are required. So where all these people are going after a period of time? So every year they are asking again and again, why such people are difficult to work over there, or people are not able to cope up the pressure over there? What is the difficulty of recruiting a lot of people over there?
So one thing is, but it's uptrending. It's an uptrending, industry. So actually, more and more US companies are coming to India for taking up, getting business to India, basically. So which is why that's one of the reasons that they're wanting more people. The second is that some particular type of coding called risk adjustment coding, HCC coding it is called, that is seasonal in nature. So if you are a HCC coder, you already know that it is seasonal in nature, and the organization also knows that it's seasonal in nature. But for whatever reasons, these people prefer to do that particular type of coding, and the organizations will, onboard them at the time when the season starts, and then offboard them at the time when the season ends. So it's a cyclical sort of a thing. It's not like you're getting thrown out of the company or something of that sort. It's the nature of the job, and that is very clear both to the corporate as well as to the coding community who does it.
So how the students can choose if they want to be a coder or something else? So how can they differentiate the seasonal and non-seasonal codings, and if they how they can prolong their career? They selected a medical coding as a career. So what is your tips regarding?
Shall I take that? Yeah. So as what Neeti said, the HCC coding is actually a seasonal coding 5 years before, but now it is becoming non-seasonal because of a lot of payers. Previously, it is only Medicare. If you remember, Medicare, Medicaid, and commercial. So Medicare is national, Medicaid is state, and commercial is again insurance companies like Star Health or ICICI Lombard. So previously it was only Medicare for which this HCC coding was happening. But now following Medicare, now Medicaid is also getting into HCC coding, and the submission time differs. The submission cycle differs from one to other. So because of that, it is almost stopping the gap of means this is till March, so Medicaid fixed that as June. So from March to June also you have something, and again from September again Medicare starts. So this June to September is being taken by the commercial. So almost the whole complete year will have, though for Medicare it is seasonal and for Medicaid it is seasonal. As a coder, if I am going to get all three HCC coding from Medicare, Medicaid, and commercial, then I am not going to be a seasonal coder. Though the coding is seasonal, a coder is not going to be seasonal. So they are going to retain people.
Yes, and plus the potential for cross training within these streams is extremely high. So so you start with being a non-trained coder, then you become a general coder, and then you become you pick up some sort of a specialty or some specific sort of coding, so HCC coding or whatnot. But that once you understand the basic fundamental, you're basically able to you can get cross trained in more than one type. And those people are even more highly paid when they are cross trained across different coding verticals. They are even more highly priced and highly trained because they bring more value to the company. They don't have to really offboard, onboard, if at all.
Okay, thank you. And there's one more question.
One more question. Yeah,
I will take it up.
So the healthcare is evolving every day. There are new diseases, new treatment options, new technologies to investigate the diseases. So as a coder, we have to evolve every day. So the simple certification, whatever we are giving at the start of the career, is sufficient, or they have to go for furthermore certification during the career?
Who's taking that? Should I?
Yeah, you can take it.
So just like any other skill, for example, even as a doctor, right, you are taught a fundamental set of things to work on. But then after that, you have to continue your education, and these are called CEUs. So once you become a certified coder, there is a program that is actually rolled out by these accrediting agencies, AHIMA and AAPC, on a regular basis, and you're supposed to clear a certain number of CEUs per year to keep yourself abreast. So it's not a very small thing. It's a huge industry, and this industry itself tries to ensure that the people who are engaged in this work are at the top. Because if you don't do your CEUs, then there's some sort of a disqualification about after some period of time, right, Rajan?
Yes, right.
That is one. The other thing is that suppose to answer Dr. Anburaj's question, suppose if there is a new technology that is coming up in computer tomography that gets added as a CPT every year in the month of January. Likewise, if there are any new diseases that is evolving, say for example, now we have classified COVID as alpha, beta, gamma, and delta. Those ICDs will be added every year, and there will be hundreds of additions and hundreds of deletions. So it is the duty of the coder, the responsibility of the coder to get updated every year, every minute, every day. That's the way we need to grow up the ladder. That's the thing. And to answer Sachin's question from an operational point of view, see, we are all humans. We tend to make errors. So that's why the accuracy of any medical record or the day activity that you do is benchmarked as 98 or 97 or between 97 to 98. So there are possibilities that 2% of error may happen out of 100 charts, right? So that kind of, there will be no hard punishment or any kind of hard and fast rule to any coder who is doing a mistake, because mistake is a mistake, and the only thing we can do is mistake should not be repeated in the future. That is the only thing that we learn from that. But if you are continuously making mistake and if your quality is below 95 on a continuously for the entire month, then you will be not thrown out of the company, but at the same time you will be given an opportunity as a program coaching or program mentoring, where you have a chance to prove again and again to improve your quality. So it doesn't mean that in a pharmaceutical world, suppose you are doing an analysis, a pharmaceutical analysis, where there is one mistake that you have done which is going to affect the entire batch of the medicine or entire batch of the drug that is manufactured. It goes also, it goes also out as a waste, right? That is the loss to the company. But here, if you make an error in a medical record, that's fine. But we highlight the medical record, we educate you that this is the mistake, you have to correct your mistake. That is how we have a benchmark of 95 to 98. It depends on specialty to specialty.
Yeah. And there is one more question from Gomati. I have a doubt. Is there any separate courses for coding and billing? I want some clearance between them. So, is there a separate course for coding and billing? The answer is yes, we have. So for coding, we have separate training, and for billing, we have separate training, and we have certifications as well, separate. So we have billing certification and also coding certification. Billing certification, there is not much variations, but coding certifications, there are a lot of coding certifications. At least I can number it around 50 coding certifications are there, but in billing, I think there is only one certification that is being offered by AAPC. So, does that answer your question, Gomati?
And if Gomati's question is, do I need to do coding and billing parallelly? I would say no, because being a pharmacy graduate, I would recommend you to choose coding as your career rather than billing.
Yeah.
Because billing can be done by any graduate who are non-science related, because you are just feeding the data from the coder and you are feeding it into an application, correct? That needs a little bit of logical analysis and typing skills and a skill set that is not comparable to a pharmacy graduate who is doing a code.
Right.
If Gomati's question is for her sister or brother, then it is fine. Who is a degree graduate, then it is fine.
So I want to ask an extension of this particular question.
Yep.
So as you are aware that in the healthcare team, there is a physician and nurses, a physiotherapist, there is a group of people, but the services of physicians are enlightened. So revenue sharing is more on the physician. The same thing, there are a lot of terminology has been used in RCM. So who is getting more revenue share? Which is a highly paid job compared to other transcriptionists or billing executive or insurance executive? Are all are same cadre? There is any difference?
Coding is at the higher end, because coding is interpretative. It requires a specialized skill set as compared to billing, which is basically as Arun was saying, billing is can be done by a generalist, kind of any graduate. So transcription is actually a little higher than billing. So we'll have billing, then you have transcription, and then you have coding. Now, transcription as an industry in India now has kind of gone down. There was a time when there was a boom, but overall transcription has now gone down. So it's basically now coding.
Yes.
Thank you, sir.
Okay. Does it answer, Anburaj?
Yeah.
Okay.
Thank you, sir. Thank you.
And the main advantage in coding is it is a day shift. 90% it is a day shift.
90% it's a day shift.
Yes.
Yeah.
Yes.
Yeah. So despite the fact that the work is getting outsourced, so it's coming from the US, a lot of US-based work actually has to be done in the nights, what they call the graveyard shift. So they have to start in the evening and go till 3 in the morning. And that kind of is, irritating. You have to do it because it's a job at the end of the day. But something like this is very comfortable, because this comes in the morning, You sit at 9 o'clock, continue till 6 o'clock, meet your targets. And if you're confident about, if you have a good clinical background, it's fun because you're using your brains. It's not data entry. There are lots of jobs in corporate world which are just data entry. So you're just sitting and mechanically putting in stuff. Fortunately, this is not data entry, which is why it's paid more. We are over our time.
Yes,
Any more questions?
almost 9 minutes. So thank you so much. Thanks for the wonderful opportunity, Dr. Venkatesh, Dr. Anburaj, Dr. Sivakumar, and whoever had facilitated this and coordinated to have this wonderful session. Thanks a lot, and thanks for all your patience.
Absolutely. Thank you to
Sir,
the whole team
sir,
and thank you to
really. Hello, can I
Yes.
can I hear my
Yes,
voice?
sir.
Yes, yes. Yeah, yes, sir. Sir, really, madam, really had a wonderful, informative, and interaction session. I hope this session interaction will motivate the students and encourage them in active learning, medical coding learning. Madam, one more request in future also, let's have a good collaboration for the development and betterment of our students' career. Can you hear?
absolutely. Yes, sir.
Yes,
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 sir.
yes.
Absolutely. Actually, we can discuss that with you offline whenever
Okay.
you want to.
Okay. Whenever you would like to plan to India, madam, in future, please let me know.
I am in India.
Oh, you are in India. Okay.
I'm in India, but
Tamil
I'm in
Nadu,
Delhi.
madam. Whenever would like to plan. Okay.
Yes.
Whenever would like to plan to Tamil Nadu, madam.
Yes, sir. Absolutely, Dr. Venkatesh.
Yeah, please to come,
In
madam.
person. Absolutely.
Thank you. Welcome, madam.
Dr. Venkatesh, I have a small
Yes,
request here.
Yeah.
If more people are interested to learn this coding,
Yeah.
once the pandemic is over,
Yeah.
we are planning to start a kind of
After pandemic, after lockdown,
Huh.
we will.
We are planning
we
to
will.
start physical classroom training.
Yeah.
Maybe 100 hours on a weekend hours. Those who can
Okay.
enroll, they can get enrolled, and we will come to your facility and we will train them.
Yes. Okay.
Yeah.
This what we are.
Okay. So let us plan something once the pandemic is over, so that
Yes.
our team can come and we can
Welcome.
create a batch and
We will. Yes, we will arrange. Definitely, we will arrange.
Okay.
Arun.
Thank you.
Thank you.
Bye-bye. Thank you so much.
Thank you, madam.
Thank you, Arun.
Oh, so thank you so much.
Arun?
I'm leaving the meeting. Thank you. Yeah, thank you.
Yeah,
I'm
yeah.
leaving the meeting.
Thank you.